One of the things that we've been very fortunate to be able to do at the Brain and Mind Centre is provide a range of innovative new treatments to young people presenting with a range of very severe and potentially life-threatening mental health conditions. One of the ways in which young people can present with unusual or atypical syndromes is because of activation of their immune or inflammatory system in their brain. When this happens in childhood, often young people, kids present with behavioural disturbance or neurological symptoms. It's very obvious that they've had an acute illness which requires assessment and expert treatment in a children's hospital. Often when these conditions present in teenage years, the situation can be quite different. If the young person presents with clear neurological symptoms like seizures, then they get immediate access to highly specialised and coordinated and effective care for the underlying immune inflammatory syndrome. However, if they present with psychiatric symptoms, as a large proportion of these young people can do, then the situation is very different. Often they get inadequate assessment in a system which is not able to recognise the complexity of the syndrome that they have. Young people are often denied care. Their families are often told that they have a personality disorder or what we call a conversion disorder. Essentially, it is a mental health problem and not a neurological syndrome. One of the things that we have been trying to champion and campaign for at the Brain and Mind Centre is better treatment, better understanding and treatment of these very severe and complex conditions. There are many centres around the world that have taken an interest in this and a lead in this. And one of the goals is to try and pull together a lot of evidence around the presentation of these cases and how to treat them so that we can provide the education and the appropriate funding and research to support the development of specialised assessment and treatment programs for these young people. We're very fortunate that we have one of these young people and their parent here today to just tell us a little bit about what this experience has been and to just illustrate the difficulty that young people and their families face when trying to access care in Australia today. So, Juliete, could you tell us a little bit, and Leanne, yes, could you tell us a little bit about the journey that you've had in terms of trying to access care? And I know you've come a long way to Sydney to try and get care, and we're very fortunate to have you here today. Could you tell us a little bit about what that's been like?
Yeah. I guess for Juliette, she became unwell and we were seeing services in Perth, but clearly she was not getting better. She was having weekly care with a psychiatrist and psychologist and on multiple medications and was becoming increasingly unwell all the time. My husband had seen an article in the ABC paper about Professor Brown. He contacted him. We were fortunate that my husband is a doctor and is able to just email another doctor, I guess. Would be difficult for other people, I'm sure. And he suggested a range of tests for him to do. She had a lumbar puncture and there was clearly lymphocytes in her CSF, and they decided that, yes, she would be a person that could possibly have an immune-mediated disorder. So we had to come to Sydney to see David Brown, which then it became increasingly clear that still treatment was not going to be easy to come by immunotherapy. We ended up coming back to Sydney and staying for 9 months to access care, to see, Dr. Scott and other people to get to the point where we could start immunotherapy.
I think when we're talking about the illness that you've had, Juliette, it's really hard probably for people to understand. And that's because you don't fit into a box that we would commonly see. And that's because these illnesses affect all aspects of brain function. They affect your behaviour, they affect how you see yourself, they affect how you perceive the world. So people can have very distressing psychotic experiences, can have unstable mood, terrible depressive symptoms, difficulty with impulsivity, with concentration, with your capacity to speak and communicate, and often have periods of confusion. And that leads to people losing that kind of sense of reality of what's going on around them, a sense of wanting to live in a world which is torture, which is literally persecuting them, and to lose hope. So I think when we talk about these illnesses, it's important to recognize that they are so devastating because they really affect all aspects of function, and devastating for parents to see that occurring in a young person. The other side of it is we have good treatments. We know that if we understand the science behind some of these disorders, that we do have effective treatments. Some of it is trial and error to get it right, but we are learning every day, and we are able to recognize much more clearly the syndromes that people present with. What we just need to do is educate the medical profession and educate young people and their families to be able to recognize this when it's happening. We've talked a bit about the journey. It was a 4-year process, and it's great to see you so much better, Juliete, but it probably doesn't necessarily give an idea about how difficult things were and how unwell Juliete was. Do you want to say a bit about when things were maybe going downhill, and particularly when things kind of reached rock bottom, what that was like, what the experience was like?
I think it's the most traumatic thing a parent or a person can go through. When you see someone, a beautiful child of yours, become so, I guess we use the word unwell, but they are desperately unwell. They are nothing like the person that you know. They are trying to hurt themselves. They absolutely zero wanting to be here. They do not want to live at all. I mean, this is not slightly, you don't know, I guess parents don't know what it's like to have to walk into a hotel room, whatever, and the first thing you do is go to all the cupboards and take all the knives out. You are hiding everything. You're hiding, everything's under lock. You get in the car, you lock all the doors. You crossing a road, you've got your arm out all the time. There's not a moment in your waking or sleeping hours where you're not consciously trying to keep your child alive.
Juliete, this has been a long journey for you, a 4-year journey, ending at the moment in a very good point, which we anticipate is going to continue. What advice would you like to give young people who are starting out or somewhere along this journey? What advice would you give them?
Well, first, I just wish that everybody has access, but while you don't have it, you really do have to put a lot of trust into the people around you, because when you're really sick, you are not yourself. I have not been myself for a very long time. I was like a complete shell of a person. And I think doctors thought that as well. So just put your head down and keep going. Hold on to whatever you can, which can be hard if it's something so stupid. Like, I would only talk about my dog for probably 2 years in an annoying way, but sticking to something, because unfortunately I think for young people, you're not in a very good position. You have zero power at this point in time. And when you don't have those resources immediately, you just have to rely on your parents, on your doctors. So having to rely on my parents, I just completely lucked out. They just did everything in their power and more to do everything they could for me. So I just really hope everyone can be in a similar position, which isn't, completely acceptable with what we have now, because we don't have enough access to the things that we need.
Personally, I think it is, obviously we're learning more about immunology a lot, especially about my illness, autoimmune encephalitis. It's like quite new to the medical world, but I think they just didn't know about it. And when they kind of don't know, they just try and stick to the things that they do know. So they kind of ignore it or push it to the side, try and think it's something else, when I just think, just look at the facts, look at me, talk to me. And then when they do, they think, well, that's new. That's something maybe I should be involved in.
Juliette, we know that your dog has been very important to you. Your family. Who have been what's your team been like? Who are the important members of your team, and what do you think have been the different roles?
Well, I think the voice behind my needs has definitely been you, Professor Scott. And it's been David Brown, Mark Yim. Those people are saying, we can see what's going on. We know this area. We need help in giving her the medication and giving her the treatment. And I think for quite a long time, I think we've just kind of picked out people that were closest to us in Perth and just thought, well, we can just hope. And they, for a while, were just kind of uncomfortable and were just doing things because of all the amazing push that we've provided and just the pressure, honestly. And I think that's what needed to happen, because now they're pretty on board. I have a hematologist who's amazing. I have a very on board neurologist now. I also have Professor Brown, I've said that, amazing immunologist in Sydney. And then psychologists, psychiatrists, my amazing TMS team, which is doing wonders for my cognition and for my concentration, which, again, the difference it makes on life. Not being able to read and now sitting here, that's all because of my immunotherapy, and then everything else has just come along with that. So my team's just great. And then, it's very important to have an amazing family system. And if you can't have that, make it with your friends and teachers and all that kind of stuff. So I'm really lucky.
So the reality is for many young people that the treating team that you need needs to be multidisciplinary, and it needs to be highly expert. These conditions are like treating rare cancers. They're very similar in terms of the assessment, the therapies that are involved, the need for monitoring and care, and the provision of all the other psychological and psychosocial support and family support. In practice, many people don't get anywhere near the level of care that they would have if they had a rare cancer. So you do need an immunologist, you need a neurologist, you need a hematologist, you need a psychiatrist involved, you need often mental health nurses, a neuropsychologist, psychologist, and as people recover, occupational therapy. So it does require these very kind of intensive teams. Not everybody's involved at the same time to be able to schedule treatment when people need it. And it also needs to work in collaboration with families. None of these things work if you're not actually working together with the young person and their family. So like many things, you need a network of people, you need a strong team, and you need to be able to work collaboratively and hear and listen to the voice of the young person and their family in making really important treatment decisions.